So welcome everyone, and thank you for taking the time today to call in and to learn about our Masters in Health Equity and Sustainability, which is part of the Advanced Healthcare Practice program in the Faculty of Health Sciences at Western University. We're really excited to be here tonight to share a little bit more about our program with you. I'll just briefly take you through our agenda for today with an overview of our session. So we're going to be starting with a really brief introduction to share a bit about Western and our faculty and our program with you. We will then give an introduction to some of the courses and instructors, followed by some information about the Capstone experience, tuition, and the question and answer period. So my name is Lesley Gittings. I'm an assistant professor in the School of Health Studies, and I'm the co-field leader of the Advanced Healthcare Practice field in health equity and sustainability, along with my colleague, Dr. Anushka Ataullahjan, who's here tonight. She's also an assistant professor in the School of Health Studies. And we're also lucky to be joined by two fantastic folks who work to run the program. Caitlin, who is the program assistant for the Advanced Healthcare Practice, and Fatima Kawaja, who's the program coordinator. So we look forward also to hearing from them later. And at the end, we'll have a question and answer where we will answer any questions that you have. So with that said, I'm now going to turn it over to Anushka to share a little bit about where we're sitting and about Western.
Great. So, for those of you that may not be as familiar with Western University is located in London, Ontario. Hopefully, some of you will have the chance to visit Western, if not in the next few months for convocation. We just had our first convocation a few weeks ago for the health equity and sustainability field. And there was a great attendance, and it was really nice for everybody to get together in one place and to celebrate together. So, Western University has an amazing reputation globally. It is ranked amongst the top 1% of higher education institutions worldwide. And you see this translate into a lot of different aspects. We have a strong research intensive faculty. So, that means that you, as a student, are learning from folks that are really at the cutting edge of research. We have incredible facilities, including multiple libraries. And we also have a really strong employment rate. And our most recent estimates suggest that 92% of graduates find employment 6 months after graduation. So, at the School of Health Studies, and that's our building right over there, we take a very interdisciplinary approach to health, and this is reflected in our Health Equity and Sustainability program, where you will be taught from colleagues from a range of different disciplines, and they approach that into their teaching, drawing on equity, on law, on social sciences, public health, to inform the material that they are sharing with you. I also really do want to flag that Western University is really at the cutting edge of sustainability. We have recently been ranked first in Canada in sustainability rankings and third in the world in global impact. So, as a part of the Health Equity and Sustainability program, you'll be able to be at an institution that is really practicing these values that you are learning in the classroom as well. So I will now hand it over to my colleague Lesley, who will take us through some more information about the program.
Okay, thanks, Anushka. So before we get into it, we wanted to hear from you. We're really excited tonight. We have lots of folks who are interested in the program, and we wanted to know, why are you interested in health equity and sustainability? Now, this doesn't need to, I'm sure many people have, a deep passion for this, but if you do feel to put a few words into the chat about what you're interested in. Why are you interested in health equity and sustainability? This is something that's really important for us to know as we also tailor our course offerings to people's interests. So feel free to just pop a word or a couple of words into the chat about if there's a certain area in health equity and sustainability you're interested in, or if you have anything else you want to share. Great, thank you. So we have a response from Keenan, who's interested in Indigenous health equity and sustainability approaches. Fantastic. Thank you, Keenan. Just give it, yeah, a couple more seconds, as I'm sure folks are thinking about what they want to say. And okay, so Nicole is interested in health equity for aging populations. Great. And Bonnie says that they are working with international students and Indigenous groups and have a passion for health equity. Fantastic. And Jenna, rural and remote sustainability. Great. So please keep posting them in. It will be great to hear as we continue the session. But just to say, I think that these responses are fantastic because as you will soon see, we do have a really strong interest in addressing issues of health equity for populations who have been marginalized due to social and structural and environmental systems of oppression. And also we do have a focus of a life course approach. So we're very interested from childhood to aging. So great, thanks for everyone who popped some information into the chat. Feel free to do so if you haven't yet. And I'll just jump a little bit more into our program. So this program is part of a broader program called the Advanced Healthcare Practice. It is the first of its kind in Canada. It's a 1-year, 3-term course-based master's program, and it uses a variety of approaches to teaching and learning. And the fields of study really offer a range from advanced clinical practice to critical appraisals of research evidence. And we have 8 current fields of study, and you'll see that we're the newest field of study. So health equity and sustainability, we are, yes, thank you. So as Anushka mentioned, we just graduated our first cohort, and we've welcomed our second cohort. So we're a very new program, which we see as a strength because we are also very current in terms of our teaching as well as our offering to really current events and issues in health equity and sustainability. Next slide, please. So as all of you are aware, and is clear from your responses as well, health equity and sustainability are really, really becoming increasingly acknowledged as important in health systems globally. And there are certainly a number of recent as well as ongoing factors that make this the case. If we're thinking about pandemics, climate change, humanitarian crises, there's really an increasing importance on understanding and addressing issues of health equity and sustainability. And what our field is really aiming to do is to position students as well as professionals to become leaders across a number of different types of organizations. And Anushka will share a little bit more about that later. And I'll actually turn it over to Anushka now to talk a little bit more about our program and how it's structured.
Thank you, Lesley. So our program is a 1-year master's, and it's split into 3 different semesters, and it is entirely online and asynchronous. And we really draw on this interdisciplinary approach. Like I said a little bit earlier, drawing on a variety of different disciplines in your courses, focusing on equity and justice, and really getting to what is underlying the differences that we see with respect to different health outcomes, getting to the core of that. And we really teach students how to look at that across the life course, so taking this life course approach. And we really want students to develop that knowledge and skills to be able to think of sustainable and equitable solutions to the health issues that we are seeing in our day-to-day lives. So you may be wondering, is this program for me? And really, the folks that we see this program being tailored to are individuals that see themselves as current and future health leaders and have a strong commitment to health equity and sustainability. And so that can include the design and the implementation of health services, it can be policy, it can be research, or it can be decision making. And related to that, we see our students going into a range of different career opportunities. And these can include things such as government departments and agencies. Some of these are related to health, some of them are health adjacent, different UN agencies and multilateral organizations and NGOs. And also Sustainability is becoming more and more of a focus of a variety of different corporations. So there's also the opportunity to explore job opportunities in industry as well. So our program is governed by a variety of different learning objectives, including this focus on equity, so equipping students with this equity lens and really helping them understand the importance of using this equity lens to address different issues of health related to health and sustainability. Focusing on evidence, so understanding how to develop evidence-informed arguments, how to implement evidence, so to take that evidence that you are learning about and to actually translate that into policies, into programs, into action. And then also to develop those professional protocols and that professionalism that is really, really important as you move through your careers later on. And I'll hand it back over to Lesley to take us through the next few learning objectives.
Great. Thanks, Anushka. So something that's really important for us in our program is acknowledging that health is socially and structurally determined and constructed. And I could see in some of the answers that were coming through in the chat, interests in different populations that experience poor health outcomes by design of our social and structural systems. So really understanding where those health inequities come from through a social and structural lens and looking at health system drivers. We also engage multi and interdisciplinarity in our work. So we really believe that these intractable and big and challenging health issues can not be solved by only one view alone. And it's really important to bring in different disciplines into the conversation. And I think this is really a strength of our faculty as well. So we have social scientists, we have anthropologists, epidemiologists, implementation scientists. So folks who are looking at and address ethicists as well. So folks that are really looking at and addressing health issues from multiple disciplinary perspectives. We also have a focus on critical thought because this is a really, really important skill. We can provide information about current trends, but at the end of the day, we want students to leave able to take on and critically think about these pressing health challenges because these are really important skills that folks can then go into the world with to affect change. And to that effect, we also really encourage learning about communication to diverse audiences. So being able to write an academic essay or paper is very important. And at the same time, we acknowledge that different audiences need information in different ways. So for example, in our course offerings, we have assignments that will focus on things like policy briefs, scoping reviews, oral presentations, so that students really leave able to communicate in different ways to different audiences. And now I'll share a little bit about what the program entails. So the program is really structured into three parts. The first is there are 3 mandatory online courses, which I'll share with you in a minute. And then we also have elective courses. So the reason why we do this is we want students to leave with a really strong foundation in terms of key principles in health equity and sustainability. And at the same time, we know that students will come in with different interests. And we want to make sure that our offerings provide that flexibility to meet your interests and needs. And then the last part, which Caitlin will talk about a bit later, is the Capstone experience, which is an opportunity for students to gain practical and real-world skills in their area of interest. Next slide, please. So for our mandatory courses, the courses, so you can see them named across the top, are the mandatory courses, but we wanted students to have an opportunity to kind of choose their own adventure a little bit based on their interests. So the instructors are pictured here, and just to say, they are the current instructors and they change from year to year. Although we do, for example, I'm teaching the same course and Anushka is as well. The first course that everyone takes is in Equity and Health Systems, which provides a foundational overview for the rest of the program. And then students can either choose between taking a course related to sustainability, so either an implementation science course with my colleague, Dr. Obadima Izizika, or a course with myself on environment, health, and sustainability. And then there's similarly a pick for either taking global health with Dr. Ataullahjan, who's here today, or health Services, Systems, and Policy with Marion Du. So the idea being if you have more of a global focus or a local focus, you could choose, or if you're interested in sustainability for an environmental perspective or more from a systems perspective, you also have choices. So those are the mandatory courses. And then we offer a wide range of optional courses as well, or elective courses that you can pick between based on your interests. So for example, Nicole being interested in aging, we have a healthy aging course that might be of interest to you. So that's an overview of the course-based offerings, which are all online. They are all asynchronous. And then I'll turn it over to Caitlin to share a little bit about the Capstone experience as well.
Thank you, Lesley. So the Capstone experience, it's a standout feature of the AHCP program. It consists of a 100-hour non-clinical mentorship opportunity in a healthcare setting of your choosing. It really allows students to identify what they want to leave the program with, what experiences, competencies, and skills. So students enroll in the Capstone experience each term. So it's a full year component. The mentor, students identify mentors within their own communities that are local to them. And the mentor can be an individual from your own existing network, or it can be someone that you find in preparation for joining the program. Students participate in experiences and settings across the health sector, from research, education, government or regulatory bodies, or even commercial startups or larger health companies. Often these projects involve policy or program evaluation, policy or program development, quality improvement projects, or data collection as part of a larger research project, scoping or systematic reviews, or a leadership/management experience in a health setting. So it's what I love about the Capstone experience is it's really unique to each learner. And so there are certain competencies for the health equity and sustainability field that you will come up with a learning plan with your capstone mentor and your academic lead. They'll come up with a learning plan and project objectives, and you'll participate in this project throughout the year. And you will, the project culminates in presenting at a research day. It's a virtual research day in the summer, and all the students present a 5-minute project presentation on what they learned, what they did, what they achieved. One note that I have for students starting the program is you have to be mindful of the scope of your project. We often have very eager students, and especially those wanting to do more research-minded projects. You just have to think about what can be achievable within the year. But yeah, it's a really exciting aspect of this program. So yes, thank you, Lesley. These are the competencies, the core competencies for the HES field, the health equity and sustainability field, that the students have to incorporate into their project. So expertise in health equity and sustainability, systems thinking and applied expertise, critical reasoning and creative problem solving, interprofessional collaboration, self-awareness and reflexivity, and expertise in implementation science. So you have to design a project around those things. So applying to the program, the application portal opened November 1st. The application deadline is April 30th. So if you've previously studied at Western, you can apply through your student center using your Western credentials and clicking on the admissions tile. If you've never previously applied to a grad program at Western or attended Western, you can apply through the SGPS application portal. The general admission requirements are listed on that slide there. Importantly, applicants should have a bachelor's degree from a recognized university. And the application portal will prompt you for all the required items. So don't feel that you have to madly write down what I'm about to list, but you will be asked for transcripts from every institution, post-secondary institution that you've attended, the names and contacts for 2 referees, and then some program-specific items such as the supplemental questionnaire, a personal statement, and proof of current employment if you are currently employed in a health-related field. If you are not currently employed in a health-related field, please upload a blank PDF that just says that I'm not currently employed in a health-related field. Feel free to discuss previous relevant employment experiences or volunteer experiences in your personal statement or on the supplemental questionnaire. I tell all applicants to take advantage of the open-ended prompt for the personal statement. I think it's something to the effect of what are your objectives in applying to this program? So the personal statement provides each applicant with the opportunity to really explain to the admissions committee why they want to join this program, what kind of impact they want to make in the field, and relevant previous experiences, and things like that. If you have any questions about the application process, please email ahcp@uwo.ca. And finally, just a quick note about tuition. Please note that tuition is always subject to change. It is set not by the program, but by the university, the Office of the Registrar. Currently, domestic tuition is about $14,000 Canadian for the full year program. And students pay per term tuition, so you will pay in September, January, and May in per term installments like that. And the international tuition is approximately 42,000 Canadian. All students also pay a $700 mentorship fee each term, so that is used for the Capstone experience because you have some mentors involved in that. So that's an additional $2,100 per term. If you have any questions about tuition, you can find the most recent fee schedule on the Office of the Registrar's website. And as I said, it changes from term to term to year, so just be mindful of these numbers.